Hi everyone, welcome back. Today we're joined by Emily Hart-Hayes, a certified nurse midwife here at Intermountain Healthcare, to talk a little bit about what midwife means to you when you're pregnant and giving birth here in Utah. We're going to explain a little bit about the differences between a midwife and a labor and delivery nurse and just have a great conversation with her today. So Emily, thank you so much for joining us. We really appreciate it.
Thanks for having me.
So we'll start with the basics. Do you want to explain a little bit about what the difference is between a midwife and a labor and delivery nurse, just so we can kind of set the stage?
Yeah, absolutely. So a certified nurse midwife is an advanced practice nurse. That means that we have a bachelor's degree as a nurse, and then we go on to earn a master's or a doctorate degree in nurse midwifery. So you can think of a certified nurse midwife in our healthcare system as someone who's similar to a nurse practitioner, someone you might see for primary care, and we specialize in women's health and pregnancy and birth. So an OB, like a labor and delivery nurse, they are educated as a nurse. They're either going to have an associate's or a bachelor's degree in nursing. And many certified nurse midwives start out as labor and delivery nurses and then go back to school and earn their master's degree or their doctorate degree in nurse midwifery. Okay. And in Utah, that is the certification and the licensure that we have. There are some states that have certified midwives that practice in a very similar scope, but their bachelor's degrees are in some other field other than nursing.
Okay, so there can be a certified nurse midwife and a certified midwife.
Yes, and there are also other midwives, and that's why it's so complicated and confusing to some people in our country, because we have lots of ways to become a midwife. In the hospital setting, you're going to be encountering a certified nurse midwife if you're getting your care here in Utah.
So let's talk about the difference between a midwife and a physician. We were talking earlier about that you do other things besides just being involved in births. So what's the difference between a midwife and a physician?
Yeah. So a midwife in our system, if you think about for your pregnancy care, say you find out you're pregnant tomorrow and you think, who am I going to see to get my health care as a pregnant person? You can get care from a certified nurse midwife, and you go to your clinic visits and you see us through your whole pregnancy. And then we also attend and care for you during your labor and your birth and in the postpartum period. And we also see patients who are not pregnant, but we can talk about that later. An OBGYN plays a very similar role, right? You can see a physician for your prenatal care. You go to your appointments with them, and then they come and they're going to be the person who delivers your baby. So if you are an overall healthy person, you don't have any high-risk conditions like pre-existing diabetes or high blood pressure or hypertension, those are examples of things that, you have a higher risk condition that maybe seeing a physician would be a better fit for you. But if you are a healthy person who overall doesn't have any chronic health conditions, then midwifery care is really appropriate because most of the time pregnancy is a normal, healthy, physiologic event. And we're there to help ensure that that continues and to help people live the healthiest lives possible, right? Intermountain's motto, but to help women in pregnancy have a healthy pregnancy.
You mentioned people choosing a midwife over an OB physician for their actual labor and delivery of the baby. How does that conversation typically start if you're a new expecting mom and you aren't sure which way to go? What kind of resources or information would you provide to someone in order to choose which way they should go?
Yeah, so usually, I work in clinic. I'm in clinic a few days a week, and I work in labor and delivery other times. And so usually what happens is somebody will call our office and say, hey, I'm pregnant. I need to get set up with a provider. And if you don't have any problems, then we might say, hey, we have an appointment with our nurse midwife, Emily, and they could come and meet me and start their care with me. Okay. If somebody wasn't sure who's a good fit for me, right? I mean, that's ultimately what we want, is somebody to have a care provider for pregnancy and birth that is a good fit for them. They share a philosophy of how this care is going to go. And their values align, right? You want somebody who will listen to you and respect your point of view in your own care. Mm-hmm. And so Usually, if somebody isn't sure who they want to have as their care provider, they can usually call a clinic and say, "Hey, I'd like to set up a meet and greet visit." And I know that I think all of our midwife practices within Intermountain are happy to do a meet and greet visit with somebody. It's not a medical visit. It's not going to be billed to insurance. It's just a way for somebody to meet the midwife and decide whether that's somebody who they want to have do their prenatal care for them.
How many midwifery groups do we have within the Intermountain system? If you live in Logan, Utah, or down south, do you have access to these groups in other areas besides the Salt Lake area?
Yeah, Intermountain has midwife groups all the way from southern Utah all the way up to northern Utah. So I know there are midwives practicing in Logan, all along the Wasatch Front in Layton, at Intermountain Medical Center here in Murray. And my group, we practice in the south end of the Salt Lake Valley, so Altaview and Riverton hospitals is where we have clinics. I know Utah Valley has a few practices that have midwives. So if somebody were interested in midwifery care for their women's health needs, pregnancy or otherwise, they could go to intermountain.com or .org and search by provider, just like you would for an OBGYN or an internal medicine specialist or an ear, nose, throat doctor.
So in the atmosphere of COVID-19, too, a lot of people are having trouble understanding that our hospital systems are still a safe place for them to come to give birth, to have that experience they wanted to. How does having a midwife kind of ease someone's concern of not being able to get the support they originally thought they could when they were going to give birth?
Yeah, I think that midwifery is especially well suited to help people navigate this very uncertain time. Our whole philosophy is that we are there as partners for you with your health and to help you make the decisions you need to make. We typically are there with you throughout your entire labor and birth. We're there providing labor support, emotional support, physical support, and to help you have a safe birth. We know, based on what we're learning about COVID-19, is that only 2% of COVID cases in our state are transmitted in a healthcare setting. And so the vast majority of cases, 98%, are happening in the community, either through family member contacts or otherwise in the community. And so I think that we can assure people that being in the hospital for labor and birth is a safe place to have your baby. You're not likely to contract COVID-19 by coming to the hospital, and we're there to provide support for you no matter what happens during your labor and birth. So I know the Intermountain has some visitor restrictions. On labor and delivery, we're saying bring your support person, your spouse or your partner or another support person. And we're limiting it to one person to keep everybody safe, but we're there to provide that extra support. Sometimes people have hired a doula. A doula is a labor support person who their whole focus is to do that labor support, right? Emotional support and physical support. And because right now we are only able to have one support person attending people in labor, that's really thrown a wrench in some of our plans. Mm-hmm. But I know that the doulas, just like the midwives and the labor and delivery nurses and the doctors, we're all trying to be flexible. And many doulas are offering electronic virtual labor support, so via a tablet or a smartphone or telephone, and working in a team in that kind of way with labor and delivery nurses and midwives and partners so that women feel supported.
How else has the labor and delivery experience changed with COVID-19? What happens when someone calls you, they say they're going to labor? Is there differences in when they get admitted to the hospital and then when they're actually going through their birth?
Yeah, that's a good question. I think most of what happens in labor and birth is the same. The things that are different that I think from if I were giving birth in the era of COVID, I would notice your midwife and your labor and delivery nurse and your doctor, they're going to be wearing a mask and eye protection and maybe even a face shield. That's not usual. Usually we are not wearing those things. So we're going to be wearing those personal protective equipment, and it might changed what we look like, but we're still there to provide all the same care that we normally would. We are in Intermountain system screening every woman who comes in and is admitted to labor and delivery for COVID-19. So even people who don't have any symptoms, we are testing women so that we know, because we've learned about COVID-19 that people can have this but not have symptoms. And so testing everybody will help us care for babies after they're born and help keep everybody safe. So that's a difference that we didn't used to do, but it's not a horrible test. It's not comfortable, but it's not that big of a deal either.
We talked about support people beforehand. What is the importance of having someone there to support you through the birth that's not just your midwife or your OB or your nurse? What is the importance for the mom giving birth to really have that person there, especially right now?
Yeah, I would say that as humans, we were not made to birth by ourselves. And we are social creatures, and we need that emotional and physical support of the people around us. Now, who provides that support? I think, it depends on how important is that for you. So some people choose to hire a doula who provides that extra continuous labor support. And folks who hire a doula usually are, their goal is to have an unmedicated birth, so a natural childbirth, not have an epidural for pain management. But there are people who are opting for an epidural who might choose to have a doula as well. But we do know that having continuous labor support reduces the chances that you may need other interventions, reduces the chances that you might request pain medication, and can make the overall experience a positive one, even if the birth doesn't go exactly how you had envisioned or planned. So people who have that continuous support can feel supported and that they made the decisions that were right for them, and make it so that they aren't alone. I mean, can be a scary process, and it can be an incredibly rewarding process, obviously.
What's your favorite part about your job? What makes you come back every day?
Oh, gosh, there are so many things I love about caring for women. In the clinic, I love supporting people and navigating through these decisions and helping people feel empowered to make those decisions for themselves. In labor, women and their strength just is amazing to me every time. Every time I see someone navigate that process and come through that stronger than ever, it's just so rewarding to see that process unfold. I love the sappy pappies. I call them dads crying at the birth of their child. I cry every time they cry. I just love seeing families grow, whether it's the first baby or the fifth baby or in between or beyond. It's an amazing thing to go into a process with, say, 3 people in the room or 4 people in the room, the nurse and the midwife and the partner and the laboring woman. And at the end of the day, there are 5 people in that room, right? We've got this new baby who's been born. It's really it never gets old.
That sounds like it would be very fun and rewarding. And I'm sure it's scary at times as well.
Yeah.
You mentioned earlier, too, that as a midwife, you don't just do care for people who are pregnant right now, but you also do other sorts of care. Can you talk a little bit about that?
Yeah, I think most of us, when we think of midwives, if we think about midwives, we think of home birth and out-of-hospital birth. So we know midwives do out-of-hospital birth and birth center birth, or home birth and birth center birth, and then also hospital birth. But we also think pregnancy and babies. And so sometimes when I'm like at a health fair, for example, and I see a 50-year-old lady walk by and she sees me and she says, "Oh, I'm finished with that part of my life." And I say, actually, we provide well woman care. We do annual exams, pap smears, breast exams. We do contraception counseling, prescribe contraceptive pills, do IUDs and contraceptive implants. We do care for people and with gynecologic concerns like urinary tract infections or vaginal infections. So we do the full scope of women's health care. And then we work collaboratively with our physician colleagues if somebody requires a different level of care, whether that's to think about surgery or other higher risk things.
Is there anything else that you want to mention about being a midwife at Midwifery and what your experience has been like, especially right now?
Yeah, I think that, first of all, midwives care for women in all care settings. And so we also collaborate with physicians so that we can provide the safest care and the right level of care depending on what's happening with someone and their personal experience. In COVID, we are all learning to be flexible. Midwives, we like to boast that we are flexible anyway, right? Like there's a joke that says midwives do it in any position because we're there to support you and what works for you. It's not about us. And so COVID-19 is definitely challenging us to be flexible. We want to continue to provide high quality care to women and their families that's personalized even when we have visitor restrictions and personal protective equipment and all of these other safety measures in place as well.
And how can people get in contact with you too? If they want to book an appointment with you or speak with you about something that's upcoming, will you talk a little bit about really quick where you work again and the best way to contact that?
Yeah, so I'm primarily in clinic at Riverton's Southridge Clinic. So if you go to Southridge OBGYN, you could call that clinic office and make an appointment with me. I also see patients at Altaview, and I'm in a group practice with other midwives, and so we work together to care for our patients. And then all of our deliveries happen at Altaview Hospital. So either Altaview Women's Specialists or Southridge OBGYN would be a way to get in contact with me specifically. And if somebody lived in another part of the state, like I said, if you go to intermountain.org and search for a provider for midwifery, you can find people who are in your geographic area that provide similar type of care.
Well, Emily, thank you so much for joining us. We really appreciate you taking the time to talk about this. And if you guys do have any questions, like she said, you can go to intermountainhealthcare.org and search for midwives or a provider near you and get a little bit more information. We'll also throw up some links later that talk about different locations and their areas that you can get to. We also still have our COVID-19 hotline available at 844-442-5224. And we also have our emotional health support hotline that's available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. If you need support or someone to talk to, it's a really great place to get that resource. Thanks, everyone, for joining us. We'll see you next time.